My name is Richard Buonocore. I'm a neurosurgeon at Neurosurgical Associates of Central Jersey. I like to believe that neurosurgery found me. Initially, after graduating from medical school, I did an internal medicine residency with the belief of becoming a cardiologist. But through my training, I realized that my skills were in the operating theater. I then did a research year at the Brigham and Women's Hospital in Boston in neurosurgery and stereotactic radiosurgery. Subsequently followed it up at Thomas Jefferson University Hospital. It is the ability to have a direct effect on a patient's care, such as taking out a brain tumor or relieving pressure off the spinal cord or the nerves, and then within hours, the patient feeling significant relief. I also enjoy the intricacies and the focus that are associated with neurological surgery. My philosophy of care is be the best doctor for the patient. What I mean is be a better doctor than a surgeon. Take care of the patient. Always do what's in the patient's best interest. Listen to the patient and treat the patient as an extended family member. I always tell my patients, don't be afraid to call. Once a patient, always a patient. What is unique about our practice is the experience we have to offer, the diversity of our care, whether it be a brain tumor, a spine issue, or a peripheral nerve issue such as carpal tunnel. But most importantly, it is the compassion and devotion which we offer our patients. My most inspiring case was a young 21-year-old boy who was skateboarding on a Friday afternoon, fell, had severe brain trauma, presented to the emergency room seizing and unconscious. He was brought to the OR for emergent surgery. The injury was so severe that over the next several days, he required 4 complex brain surgeries. Throughout the time he was in the ICU, his family prayed to Don Guanella. I always gave them faith and believed that he would pull through. One day he miraculously opened his eyes. The next day he walked. He eventually left the hospital, went to college, got married, and the belief was that praying to Don Guanella was a miracle. I was interviewed by several cardinals and bishops from all over the country and from Rome and had to testify on what had transpired. Don Guanella was then ordained by the Pope a year later and became a saint. My future goals for Neurosurgical Associates is to continue offering access of care with the most sophisticated, diverse, and compassionate care in the region.